When we talk about dialysis, there are actually three extracorporeal therapies. One is hemodialysis, which is based on diffusion. Second, hemofiltration, which is convection based. And the third one is hemoperfusion, which is based on adsorption. So let's see how they differ. Hemoperfusion is rare today. Here, there's no dialysate. Blood simply passes through a cartridge packed with adsorbent material. This is great for poisonings, but not for routine dialysis. And what we use every day is hemodialysis. Here, blood and dialysate meet across a semi-permeable membrane. Here, dialysate has virtually zero urea creatinine, so small solutes diffuse from blood to the dialysate. And as dialysate picks up waste, its effluent saturation rises. With an average blood flow of 300 and dialysate flow of 500 ml per minute, the effluent saturation is usually around 50%. Now let's come on to hemofiltration. Hemofiltration works in a complete different way. Here, pressure pushes the plasma water across the membrane. Whatever fits through the pores, which includes small and many middle molecules, gets carried with this convective flow. And because of this, the ultrafiltrate has solute levels similar to the plasma. So the effluent saturation here is close to 100%. And here we replace the removed fluid with ultrapure sterile substitute fluid, which has electrolytes and buffer but no toxins. So now comes the big question. If hemofiltration is that efficient, why don't we do it every day? First thing is, hemofiltration demands stricter water purity than hemodialysis. Because here we are infusing larger volumes of fluid directly into the bloodstream, we need ultrapure substitution fluid. And the second reason is filtration fraction. Filtration fraction is nothing but the amount of fluid ultrafiltered for a given plasma flow, and it usually has to be kept less than 25 to 30% to avoid hemoconcentration and membrane clotting. Now let's see how filtration fraction influences hemofiltration clearance with an example. Let's say we are keeping the blood flow as 300 ml per minute and the patient's hematocrit is 30%. Now his plasma flow would be QB into 1 minus hematocrit, which is 300 into 1 minus 0.3, and that's 210 ml per minute. And we have seen safe filtration fraction limit is below 25 to 30%. And if we put it here, safe filtration is only 50 to 60 ml per minute. And that's the clearance in hemofiltration. But hemodialysis routinely gives 200 to 250 ml per minute small molecule clearance, which is approximately 3 to 4 times higher with much less complexity and lower water quality requirements. So that's why hemodialysis remains the workhorse, and hemofiltration or hemodiafiltration are used whenever we need better middle molecule clearance.